Bismillah ar-Rahman ar-Rahim. I'm Dr. Mohibullah Wazir. Today we discuss the regulation of the function of the heart. Very interesting. Note, the heart is a muscular pump, myogenic pump. Its function is to pump the blood to all the parts of the body from the head to toe. Sometimes more blood is needed and sometimes less blood is needed. While the heart is the intrinsic and extrinsic factors which regulate the function of the heart, and at all the time it gives the sufficient blood to the body according to the need. Now, one is how the heart function. Number one is the intrinsic mechanism. The heart in itself, look, it is having the SA node and AV node. Note the part. The SA node and AV node is again a cardiac muscle, but Almighty Allah has modified it like that it acts like a nervous tissue and it generates the impulse at the rate of 70 to 80 per minute without it do not need any nerve supply. Without any nerve supply, it can in its own generate the nerve impulse and helps in contraction of the heart 70 to 80 times per minute from SA node to AV node and then through the bundle branch, right and left bundle branch, and then through the Purkinje fibers, the whole heart is being supplied, and in this way, without any nerves or without any hormonal support, the heart can generate its own conduction at the rate of 70 to 80 per minute. But when there is a condition of stress, exercise, hypovolemia, and increased function of the heart is needed, then the SA node do not have the capability to beat the heart more than 70 to 80 per minute. While needed is that the heart should beat more forcibly, contractility should be increased, and the rate should be increased, while the SA node has not the capability. Now the SA node request this autonomic nervous system, that is sympathetic nervous system, through the medulla oblongata. What is the mechanism? Note the point. In the aortic arch and at the bifurcation of aorta, there are receptors or sensors which are called as baroreceptors and chemoreceptors. The baroreceptors, it note or it smells the increase and decrease in blood pressure, while the chemoreceptor, it note the increase or decrease in carbon dioxide and oxygen or pH level of the blood. So from these chemoreceptors and baroreceptors, that afferent pulses passes, you note it over here, the afferent pulses passes through the glossopharyngeal and then the vagus nerve. You note over here to the nucleus of Tractus solitarius in the medulla oblongata, and then maybe to the thalamus, and also to the dorsal vagal nucleus of the vagus nerve, which we call it as the cardio respiratory center in the medulla oblongata or the cardiovascular center in the medulla oblongata. When the medulla oblongata and the sensory system note that the oxygen and or the blood pressure is being fallen out, then what happens? The descending information comes to the sympathetic nervous system at the level of, you already know the nerve supply of the heart. Please, to understand my this lecture, note first listen my lecture of nerve supply of the heart as well. To the sympathetic nervous system, ganglion or sympathetic chain, and then that comes to the heart, and now the sympathetic nerve again through the SA node stimulated, and it increases the heart rate and it increases the contractility of the heart as well. And this do what they do through the epinephrine and norepinephrine secretions. It increases the heart rate and as well as it increases the contractility of the heart as well. But when at another side, if the human being is at rest or is sleeping and the heart rate needs to be decreased and also the force of contractility needs to be decreased, then the parasympathetic nerve comes into stimulation, and the parasympathetic supply is coming through the vagus nerve and the cardiac nerve, which decreases the heart rate and decrease the contractility, and this acetylcholine is the neurotransmitter being used over here by the parasympathetic. But all these to increase or decrease the heart, the impulse is coming from the medulla oblongata, from the cardiovascular center. Okay, then some other factors also regulate to increase, that is the hormonal. And the hormone number one is from the adrenal medulla. For adrenal medulla, the epinephrine and norepinephrine is released, which also is cardio accelerator and increases the heart rate. While from the thyroid gland, the thyroid hormone which is coming from thyroid gland, it increases the sensitivity to the heart rate, increases the heart rate. Catecholamine is also being used for acting, and dopamine also being act. ADH, antidiuretic hormone, indirectly affect the heart rate by decreasing the volume of the blood or to do more diuresis, and that also indirectly affect. Okay, now these are the different factors: this way tension, anxiety, or preparation for fight and flight. That also, but increase the heart rate, but also the mechanism is the same. That it acts through the sympathetic system and increasing this epinephrine and norepinephrine. In this way, these are different factors. Number one, SNOW node, and number two, the sympathetic and parasympathetic, and third, the hormones, and also over here, the heart rate. The heart is also being 100 Frankfurt law, that is increase cardiac return, the venous return, the increase will be the heart rate or the contractility of the heart. That is also one rule. Then one other rule which we call it brain bridge rule, and that is also being used also in the relation with the baro and chemoreceptor, that is the brain bridge reflex, and that is used in that way. Okay, this is all about, in brief, the mechanism of regulation of the heart function. Thank you very much.